Hi, everyone. Welcome back to the next What the Floss podcast. I'm here with my good friend, Lindsay Fetters, and she is an RN, and I'll explain her role and why she's here in just a moment. I've been a dentist for many years now. So the question that I got asked last week was, why did I move into the med spa region? So for those of you who don't know, I started a med spa about 6 months ago, and we launched back in November, right, Lindsay? And Lindsay has taken lead on a lot of the med spa implementations, the trainings. She was instrumental in deciding which line of products we were going to use, what type of machines we were going to incorporate. And so I'll have her speak to that in just a moment. But I wanted to tell you why med spa. And a lot of it is when you learn dentistry, the first 2 years of dental school is medical school. So we're learning full body anatomy, physiology, histology down to a cellular level of the different layers of your skin and muscle and bone and all the things. We learn pharmacology. We learn how medicines, vitamins, supplements, how that interacts, not only having to do with your mouth and your head and neck, but again, systemically, your whole body. As I've practiced a little bit more over the last few years, I've gotten a few more letters behind my name, and that means just a whole lot of studying of a lot of things. Some of the high points that I've learned is if you have gingivitis that's uncontrolled, periodontal disease, where your gums are holding a lot of bacteria, that goes systemic. So that causes the plaque from your mouth to go into the plaque and cause clogging in your arteries. So that causes heart disease and high blood pressure and all those kind of things. So what happens here is very much accounted for everywhere else. So when I would see a patient and would take care of their head and neck area, their mouth, make them feel great, make them healthy again, it kind of lended itself to that next step of talking about the total body wellness and what kind of digestive issues they're having. If they're having acid reflux, which is something that I see very commonly on teeth, not only in pregnant women or women that just had their babies, but in a lot of stressed out individuals, which that stress is the name of the game in our population these days. So when you're under a lot of stress and you regurgitate acid, and I see that on your teeth and I bring it to your attention, I tell you, start on Tums or omeprazole or Prilosec or something, some kind of antacid. But the part that I don't get to follow up with you on for another 6 months till I see you again is that when you chronically take those antacids, it inhibits the way your body can soak up vitamin B from your diet, from your supplements. So that's just like one small example of how one thing from dentistry that I noted with the acid reflux on your teeth has this cascade of events all the way down. And we can talk about vitamins and how your gut isn't going to absorb the necessary vitamins. So in order to be able to create a space where I was not only seeing you every 6 months, but I was able to follow up a little bit more frequently and then bring in medical professionals that are trained even beyond me on a lot of systemic issues, it just made sense to go into the med spa region. Now, the cool thing about med spa is we're doing a lot of health and wellness. Again, we want you to be the best version of yourself so that you can make sure that you carry out all the plans that God has for your life, because that's our goal on this planet, right? Is to fulfill what we're supposed to do for God's glory. So when I'm able to bring in these medical professionals, they have so much knowledge beyond me. And it's kind of fun because they can take the weight loss side of things, the hormone side of things, and then they can play with the aesthetic side of things as well. So things that we do are very natural. They're very like enhancing what your natural gifts and the way that God has made you, so that again you can maximize your potential. But I digress. Let me again introduce you to Lindsay Fetters. She is an RN. And Lindsay, tell me why you wanted to be a part of the med spa. When you and I spoke, I think a year ago is when we started speaking. You happened to send me a text and said, have you ever considered adding something like this to your practice, specifically Botox training, right?
Yes, yes. So, of course, I reach out to you because you're amazing, and who wouldn't want to work with you and alongside you because you're so wise. And I
They didn't pay her to say that.
No, she
That was
didn't.
perfect.
No, but it's true. I thought I wanted to use my nursing degree in a way that could benefit others, and also I have background in pediatric intensive care. And then I stayed home with my kids and used all my nursing knowledge on them for a very long time. But when I started thinking and praying about how could I use my nursing license in a way that could impact and take care of other people, but not in a stressful ICU environment where I'm working nights and weekends and it's not great for my family and it's not great for my health. I thought about you and thought about what you were already incorporating in your dental practice and that aesthetic side of the industry and thought, I wonder if that's something that I could be a part of, because I do have a very kind of, it's a negative terminology, but perfectionistic, an ICU nurse. You don't get to be an ICU nurse without being a type A, very particular person.
Makes you great at what you do,
Yeah,
right?
it does. You take care. And so I think in the aesthetic industry, people appreciate having that type of practitioner that's going to be very focused on achieving a result that is going to be pleasing to them.
Yeah.
And also, I've had my own health journey going through stuff, struggling with PCOS and my hormones and my weight and different things. And finding a medical practitioner that really helped walk alongside those things with me was just vital to transforming how I feel. And, making big changes in my life impacted my family, my marriage, everything. And so I also feel very passionate about helping people make those type of changes in their life. And the icing on the cake is that we also get to make them feel better internally and externally.
Right,
to have the results where they feel comfortable and confident. And I want that for people. So
yeah, I remember after you had your third child, and then you were actually one of those patients that came in, and I was like, Lindsay, there's this something going on, acid reflux on your back teeth, and what is happening?
I'm the stressed out person.
You were the stressed out person.
Yeah, I still need to get that completely taken care of. But yes, I had a lot. I mean, 3 kids in 5 years and, and then developing PCOS just was really hard on my body. I gained weight. I didn't feel great. And then, new mom, stressful.
And I remember you saying the word silent reflux. So you're not the big overweight, stereotypical, businessman who's got, Tums in one hand and a phone in the other. But yours presented more like a silent reflux. So even though you didn't necessarily feel what was happening here, we could see the signs of it. And I think that caused you to investigate a little bit further and say, what is causing
What
this?
is going on? What is the inflammation? What is happening? It definitely was a trigger for me to try to get to the bottom, because I'd seen medical providers that had kind of discounted my symptoms. And I think that conversation that we had also allowed me to go, okay, something is not right and I'm not feeling myself. I'm not feeling great. Let me get to the bottom of this. And so.
And more than just putting a Band-Aid on it by, again, taking that Rolade or something, right? You actually want to find out what is the root cause of this so I can make those little changes, and then for a lifetime I'm healthier. Yeah.
Absolutely, yeah. I love being able to now, even in the last 6 months, be able to start doing that with our patients as well. It's exciting to have that comprehensive approach where we're not just Band-Aiding, that we're really looking for the root cause of their hormone issues or their weight issues and being able to help walk alongside them. I'm happy to use what I've learned to then pass it on.
And I love seeing your heart for that comprehensive care. So yes, we offer skincare, but you have said, and yes, we offer weight loss, but you have said, let's use this in a way where it's not just, here, take this product and go home and use it. You're like, you come back and have a touch point. Let's see how this is going. As you're on your weight loss injections and you start to see that sagging skin, let's get you in and use this device that is medical grade device that is very natural and safe, that uses plant-based exosomes for skin recovery. Let's help you tighten up. So as you're on this healthcare journey, there's steps along the way where you are constantly walking through and holding the hands of your clients to take them from point A all the way to point Z, I guess, because it's so comprehensive. So,
and that's really one of my focuses when I was picking the skincare line that we chose, or the devices that we have for the med spa, was how can we do something for our clients that is safe and more natural? Because I think both of our heart is, we're not trying to recreate everyone to look like Kim Kardashian. We are trying to heal people from the inside out and then help them feel really good, but in a way that doesn't make people think that they've had a lot of work done. And both of our aesthetics, very natural, well rested. Yes, we want our clients to look and feel like they are well rested, for people to notice that they're glowing, but not in an over the top artificial way.
Yeah.
And so the devices that we chose, several of them, all of them, do just that as far as naturally using how the body is made to regenerate collagen and elastin, which helps you look younger and makes your skin look like it's glowing. Several of our devices handle that. And it's just, that was definitely one of my goals. It wasn't like, how can we be the most extreme or the most unnatural? It's more, how can we incorporate what we know and have learned and also use products, really amazing devices to accomplish this in a safe and natural way.
So let me ask you about some of the devices.
Sure.
When we first started out talking, we said, oh, let's get something that is like HydraFacial, but maybe just a little bit better. So we started off talking about one particular machine called the Aquafirme. So I want you to tell me a little bit about Aquafirme.
So I chose Aquafirme because it does have plant-based serums. And you'll hear me say over and over again, I really like natural things. I want to use things that are very similar to how the body reacts. I have really sensitive skin, and so it's my priority to find things for clients. You do too, I think. We've talked about this. We're like, we can't use anything less Cetaphil. We're changing that. We are finding what works for us. But I think a lot of people have a hard time, or they're afraid of different treatments because they are wanting to be natural and safe. And so the Aquafirme uses plant-based serums, 4 different ones that are, some of them have plant stem cells in them that closely mimic our own body's cells to help ease that transition for absorption in our skin, for our skin to do what it needs to do. And I love the Aquafirme, and I did, like you said, I compared, I researched, I'm a researcher, I love looking into everything, maybe too much, but I always want to make the best and right decision. And the Aquafirme really is incredible for achieving the results to do that, like hydrodermabrasion and taking off dead skin cells and then getting the nutrients in the skin to help it be as healthy as possible. There are serums that help with anti-aging, that help block free radicals. We even have the derived hair restoration system that we can do through the Aquafirme that helps people that have dealt with hair loss. Again, another thing that helping women and men feel their healthiest version of themselves, because unfortunately, whether it's from COVID or whether it's from pregnancy or weight loss, even people are losing hair. And so what can we do that is safe, not as invasive, more comfortable, but also has the results? And that's the derived hair serum that we use with the Aquafirme. And I love that we're able to address multiple skin issues and even hair issues with that device. It's very versatile.
Oh, it was so good. So I was actually a client of yours, and I didn't grow up doing facials. Like we didn't do, we washed our face with soap and water and put Cetaphil on it, and that was it. And back then it was, I think it was called Eucerin that we used, right? So it was such a treat for me. And I thought, I've seen some of these skincare routines on Instagram where you leave there and your face is all red and it looks like you've had chemicals on your face and it's supposed to make it peel or it's supposed to mechanically abrade your skin. And that's not at all what it was like. It felt like the best facial massage ever.
Right.
And we even went down to the chest area and got the cleavage area. So it was such a treat to see all of this skin treated too. It wasn't just here.
Yeah, it's a comprehensive. I mean, so you can tell when people have only treated their face because their neck really shows their age. So I want to be comprehensive in the treatment. And it is so gentle, but really you see the results. I mean, immediately afterwards, I feel like clients are glowing after. I've had, before this, I had like maybe 2 facials. My grandma years ago bought a facial for us, and it was a German woman did it, and she was aggressive.
Helga came in to do your facial,
and she was like, "You need to take care of your skin. You only have one face." So she's like, "Spend your money on it." And that always kind of made me laugh. But now that I look back at 40, I'm like, okay, that makes sense. You need to she was telling me that probably in mid-20s, she's like, you don't realize what you need to do with your skin now is so important for that long-term health of your skin. But
so true.
I always came out of there looking like you needed to go home. You cannot go out in public after that. So that's not how the Aquafirme is. You can literally go home, and I have had people comment on my skin and say, do you even need to wear makeup? Like it looks so healthy, and it's just so
And I think
amazing.
Shayna just posted something on Instagram saying that the goal for this year is to get healthy skin enough to where you don't feel like you need makeup every
Mhm.
day. We want to be makeup free. We want to have that healthy glow.
I love that trend. I think that has
Yeah.
definitely changed in the last year and a half, where people
Yeah.
are going that more natural. I mean, they're still using some makeup, but they want to look glowy. They don't want to look caked on and
Mhm.
overdone. And I love that. Everything's trending in
Yes.
that direction.
Yes.
Yeah,
Thank
good
you,
for
Pam
us.
Anderson, for the no
Yes,
makeup
she's
look,
not
right?
wearing makeup. Yeah, she's probably had some
She's
treatment
gonna
with our device.
Yeah. I love it. And
Yeah.
full disclosure, you actually treated me for the scalp as well. So
Mhm.
I have a lot of hair. For
You do
those
have a
of you,
lot of
I have a
hair.
lot of hair, but being a woman in my later 40s, and then also being like a working woman, carrying a lot of stress of multiple businesses, I
Mhm.
noticed that I was getting a little thin up here. So the last few years, when the trend has been to part down the middle, I was always embarrassed with this crow's feet, like, or widow's peak, excuse me.
Yes. Mhm.
It would everything would mat down, and I feel like my part was really wide. And
Mhm.
Taryn loves to use that. What is it, the .5 filter or whatever it is, that to
Yes, this
zoom
is
in
a
and look
new
at from the hand
yeah.
down. So
Yep.
I would get a glimpse of this area right here all the time. And it's been what, 2.5 months since we did
Uh-huh.
it, and I feel confident enough to just
It's
part it
you're
down the
noticing a
middle. And oh
difference.
yeah, and I use my serum twice a day, and
I
it
know.
smells good. It feels good. It
And
works.
it's
And
natural, and those
yeah.
exosomes are so good. So the
Mhm.
exosome part of that derived hair serum is plant-based stem cells, which I love. And a lot of the industry trend right now is exosomes. It's very new to the industry, but they're using human stem cells, which I mean, there are some companies that make really safe ones, but inherently, it's going to be not as safe to use somebody else's human stem cells on your own body.
Mhm.
So the plant-based, I just think, is incredible for the way to go. It closely mimics our cells and then really gets into the tissue to do what we want it to do.
Yeah,
So
it worked great. It worked
mhm.
great.
Yeah, it
So
looks beautiful.
thank you. I'll just be one of those,
Just
like,
do that.
Pantene commercial.
Yes.
Yeah.
You could be on a commercial.
So another machine that I got to try recently,
Yes.
was it the Scarlet?
Mhm.
Okay, tell me about Scarlet. What is Scarlet all
Yeah,
about?
so our Scarlet is a short pulse radio frequency microneedling device.
Mm.
And people hear about microneedling all the time, and it's incredible because those tiny little needles make tiny micro injuries in our skin, and that again stimulates our body to recreate collagen and elastin. And so when you combine that with radio frequency, which is a heat, with the Scarlet, then you're kind of a double whammy to get that boost in your body's natural production.
Mhm.
And what's also incredible about the Scarlet SRF is, compared to other devices on the market, people are more familiar probably with the name Morpheus or Morpheus 8.
Mhm.
But what we've heard from clients who've experienced both products, both the Scarlet SRF and the Morpheus, they kind of come in nervous to use the Scarlet because they think they're going to have this very over the top painful experience like they've had with the Morpheus, but they're
Right.
willing. They're like, whatever it takes, I don't care if it hurts. But they're
Mhm.
nervous because they think it's going to be incredibly uncomfortable, and they're pleasantly surprised how much more comfortable the Scarlet is. And the downtime is so much more minimal. And people were
Mhm.
talking about having this type of treatment in the past because again there's multiple of these devices on the market that are similar, but none
Mhm.
function the way that the Scarlet SRF does, and the fact that the downtime is so short. I literally, when we were having, I've had it done, and I walked out the door, went to my son's football game, and I'm very fair skinned, so I can turn red so
Yeah,
quickly.
you were talking about platysmal bands earlier,
Yeah.
and you still have the red line just from touching there, right?
Do I?
So I get it.
Edit
Like, it's
that
your
out.
skin
It's
responds to
so
just even
there,
touch.
yes.
Yes.
So imagine the 25 needles stamped on your face
Mhm.
800 times. I would probably be red for a week, but
Right.
not with the Scarlet SRF. That radio frequency combined with that mechanical stamping and the gold insulated needles, it's just the best on the market. And I
Mhm.
went to that game and my face wasn't red.
Oh,
And the
I
eggs
love
that we
that.
put on ExoE, our plant-based stem
Isn't
cells,
that like the most cooling,
it
calming thing
smells so
ever?
good. It
Yeah.
smells like what you imagine a spa would smell like, but
Yes.
it immediately calms down the inflammation, and we
Mhm.
follow all of our treatments with that plant-based exosome, so
Mhm.
that also helps.
So I've been doing microneedling in the Dell office
Mhm.
because we do PRF, the platelet-rich
Right.
fibrin, for different grafting materials and things. So I've been
Mhm.
doing microneedling with the DermaPen for
Yes.
7 years now, long time,
Right.
where again, we pull your body's own good stuff and we spin it down, we get those stem cells and we
Mhm.
microneedle that back into the skin. But there is a level of discomfort to that because,
Mhm.
yes, we do the topical creams and we numb it. And, I'm a dentist, so I can numb
You
it
can
around these
numb
areas,
real
I can numb the skin Indian, but still, it's uncomfortable. You peel for about 2 weeks, and you do get this beautiful result, but I got the same beautiful result without the discomfort at all, so I was blown away.
It's that next
That was a
level of
great-
technology,
Yeah.
and that radio frequency does, I think, help like coagulate those tiny little capillaries, and it just makes it a more comfortable experience.
Oh, it was
with
so
good
good.
results.
So
Yeah.
good.
Yeah.
The next thing I want to come in for is for all my brown girls out there. It is winter time, and so this is the time to do our laser hair removal. So I swear, Lindsay, being a brown girl growing up Indian, I was born with a mustache. My mama would say no, but in every photo of me in junior high and high school, it looks like I have a 5 o'clock shadow, sideburns, like the whole deal. So I am super excited to come in for the laser hair removal. So tell me why you chose the device for laser hair removal that you did.
Well, when I was just kind of polling everyone to see what kind of med spa treatments and devices are you looking for? What are you going to the med spa for? So many people said laser hair removal. And so I chose the Alpha Pro device specifically because it also is a multifaceted device that offers laser hair removal, but we can also do the intense pulse light IPL or BBL type treatments.
See, I want to do that because I have some dark spots and things. Like I got a bug bite on my shoulder, and I want to see how the Alpha Pro does on that. So is that something an IPL machine would be good for?
IPL, the laser goes to color. So if we have brown, if we have red, it absolutely like attacks those colors and can help decrease those, kind of brings those colors to the surface so your skin can naturally slough them off. So we can do that for sure. But one of the hand pieces for the Alpha Pro does the laser hair removal. And I also have heard of people doing laser hair removal and it being a very uncomfortable procedure.
Well, of course, I've done it, right? Because the minute that I could, I went in and got that stash taken care of. I was tired of waxing and plucking.
Go ahead and get it done.
Yeah, and it felt like someone was taking a rubber band and like snapping it against my face. And they would put an ice cube on there, some cooling lotion, but it was very uncomfortable. But you kind of power through it, saying
because
that
you know what you need to do.
Yep.
And I'm not going to say the Alpha Pro is like completely painless, but we don't have to use numbing cream because the device has a coolant system where the tip of the device actually has this coolant running through it, so it's nice and cold on the skin. So we have a method that allows the skin to kind of be cooled before that heat is directed at those hair follicles.
So you're not dealing with a drippy ice cube to try to cool your skin down.
Yeah, it's a little next level high tech. So I have had people say that it's the most comfortable that they've ever experienced. And, people will go and do a series of laser hair removal treatments. And sometimes with other companies or other med spas or other devices, they couldn't even complete the treatment series because it was so uncomfortable. And this is way different.
Yeah. So can I use it on my arms?
Yes, we can use it on any area that we need to do hair removal
on. Underarms and time for bikini season. And
Yep. As long as we don't want to treat areas that there's tattoos in because the laser is going to go to the color of your tattoo, and we want to not try to mess up anybody's tattoo. But any place that they have hair, we have a special method. It may be different than other med spas where the area needs to be shaved first because we want the laser to go to that hair follicle, not just treat the hair, but the actual follicle. And it's a series of treatments. So we don't say it's 100% removal because it's a reduction, and we always go through phases in our life where our hormones change and more hair could grow potentially. But it is a series of treatments to get the best results. And so far, all of our clients have been really pleased with the results. Even by the second treatment, they're noticing a reduction in hair.
So I've been very picky about the machines that I go in, and I talk to the esthetician well ahead of time and say, I'm a brown girl. Like I need to make sure that you know that my skin is going to react differently than your skin. And so when I go in for a consult, how will you make sure that I am safe as a woman of color?
We always go through and analyze all of our patients' skin types through the Fitzpatrick scale, but also the Alpha Pro has a really little neat device that comes with it that's a melanin reader. So we always check whatever area we're treating because there's darker areas and lighter areas even on one body.
Even on one body, exactly.
So we'll test those areas and plug in. We have special parameters based on different skin types because the higher the skin type, the darker the skin, the less heat and the less aggressive treatment we want because we don't want to have that post-inflammatory hyperpigmentation results. We want to have the best results.
So you got to put me on your schedule for that.
Okay.
So I know I need to touch up under my arms, but are there can I do bikini area,
Yes.
Brazilian,
We can take it all off. You can take it all off.
I love that. And they're all medical professionals. They're all
Yes.
RNs and they're
Yes,
doing
they're all
it.
nurses. So we are not afraid to take care of any and all hair needs. And there's even a setting on the Alpha Pro that's called fast and painless. So in bigger areas like backs or legs, we can do it even faster.
So those little patches of hair that men get on their lower back that you can see at the swimming pool, can they just get that fast
Yes.
and what did you call it? Fast and what?
Fast and painless.
Fast and painless.
That's probably the only way a man would come get their hair removed if it was called
Get that
fast
little
and
shoulder
painless.
hair and that back hair done. Yeah.
Just be done with it. Because it's when it's a flatter area and you don't have to stamp it, you can just go to it so fast.
Usually, how many treatments do they need to schedule with you?
I would say I think 6 is probably a good starting point. That's where our memberships come into play. We have a laser hair removal membership through the MedSpa, and it is a 6-month membership because I do think for the most, the best results that people will want, it's a subsequent treatment because our hair is in different stages of growth. So if we just treat it once, we have some hair that is just in the turnover phase where it's already, grown out or coming out, where some is just now starting to grow. So if we space it out every 4 to 6 weeks, we're making sure we're attacking that hair follicle in the right stage to really put an end to its production of hair.
One other machine that we have in there, and this is probably the one that I'm least familiar with, but I'm so excited to learn it because I've seen a little bit of what it can do. It's called Plasmage. It sounds so fancy, Plasmage.
Yes.
But it's a non-surgical way. My understanding is it's a non-surgical way to get surgical results for certain procedures. So tell me about Plasmage.
So Plasmage is a really neat technology. It's kind of like a plasma pen. Like if you would Google the name Plasmage, that might pop up, or plasma treatment. And it harnesses plasma energy through the little tip. You don't even touch the surface of the skin with it. It just makes a tiny little carbon crust on the surface of the skin. And what that does is that tightens up that tissue and like contracts it. And then as that tissue heals, as that tiny little itty bitty like pinpoint scab comes off, then we have regenerated new skin underneath. So we can use that for so many different things. That's why I got that one at the very end. I was like, we need this too. Because I feel like it's such a versatile device. If we're having people that need to take care of skin tags or moles or, all those little skin issues that they might need treated, that can be a solution for that. But also if you have skin laxity, if you have excess skin on your eyelids or under your eyes, if you have really deep set static lines and wrinkles, and static lines are lines that don't go away no matter what expression you make. So we work on making those lines as we're continually frowning and whatnot. But for those people that just no matter what face they make, they're still there, the Plasmage can help treat those deep set lines and wrinkles. One of the modes for the Plasmage is to be able to do like a blepharoplasty, similar to that. And so
that's what I've seen on their website was that procedure being done right in here. Yeah.
Right. They call it a blepharoplasma or blepharoplasmage. And instead of going under anesthesia, getting a portion of your eyelid removed, stitched back up, and all that recovery, we can have similar results with the Plasmage, which is pretty incredible.
Yes,
for a fraction of the price.
Yeah, that's amazing. And then the downtime you said is what, 3 days?
So this is the most downtime of any of our machines, and it's still not that much. Those little carbon crusts, those little brown dots that are left behind, fall off in about 5 to 7, sometimes 10 days.
Okay.
We don't want to touch those or pick at them or anything. We want to really let the body release those whenever it's time. But pretty much after the first few days, you could apply a little bit of makeup over it if you wanted to hide it.
Okay.
So,
that's fantastic. So for people that deal with hooded eyes where it feels like it's blocking your vision or you can't get your makeup into that crease of your eye, then that sounds like a really
great
good
solution. Really deep crow's feet, those vertical levens, forehead lines, the excess skin under people's eyelids. I had it treated on my C-section scar. I had great results. You can do stretch marks. There's just so many applications for it, which is really great, I think, to address a variety of skin needs. I think all of our devices can be used in conjunction with one another. The Aquafirme to help get your skin in a healthy state. And then the Scarlet radiofrequency microneedling to help regenerate that collagen and elastin. Intense pulse light, we can address those skin pigment issues that we have. And then if we have deeper lines and wrinkles or excess skin that need treated, then we have the Plasmage. I love that there's a multifaceted approach to take care of everybody's skin needs.
Yeah.
I don't know what we can't take care of, really.
I love
So,
that. And then Botox is the fun part.
It
And
is.
for if you're a little bit later to Botox and you already have those static lines, you have a way to help with
I have a way
those.
to help with
Yeah,
them.
that's
Yeah.
amazing. I love it.
know. One of our family members was supposed to go in for a surgical blepharoplasty, but she wasn't cleared because she had a heart condition. And
Mm.
so we're exploring whether the Plasmage could be, I don't know why it couldn't
Oh,
be a great
nice.
answer for her because she was already dealing with that heavy eyelids
Mhm.
and not being able to go do that surgery. But I'm thinking, this is so much safer and
Yeah.
so much faster and so much less downtime, and we have
Yeah.
no cardiac risks. So I'm excited to offer that to her.
I love that. I can't wait to see those before and afters.
I know, it'll be good.
That's
Yeah.
fantastic. So Lindsay, I was walking out of Trader Joe's this weekend. I go in there to get my milk because they have a hormone-free milk. So I go in there to get my milk. And as I was walking in, this lady was walking out, and I swear her lips came out of Trader Joe's faster before she did. And she looked so stuffed full of filler and plastic and all this. And I think that that version of aesthetics is really popular right now, to look like you're that perfect face all the time of what you would take in a photo or Photoshop. And people have translated that into real life. And I think you and I don't see that as a true aesthetic. We don't see that as beauty. We like a little bit more of the natural look to it. And that's where you and I really connected on our mission for this MEDSPAS. So speak a little bit to that.
Absolutely. I think it's really easy in society or on TV or all these things Chris and I will sit down and watch TV and I'll be like, her lips have been done. You know, we're quick to point that out and we can definitely recognize that. And I think even going into this industry, family and friends are like, you're going to do aesthetic nursing? Like, what are you going to do to people? Like,
they're picturing like filler face.
yes,
right? What looks
they're
so
picturing that
challenging.
Snapchat filter that looks ridiculous, where everything's overdone, overfilled. And it's been really great to kind of find our footing and our way and know that there are people out there that really do desire to have a natural, enhanced aesthetic. And if you come to the med spa and you want that other aesthetic, I will find someone that will take care of you. But that's just not what our goal is. We want to make you feel good. We want to make people look natural, enhancing natural beauty, but not make them look like they've had something done. I want my clients to leave the med spa and people think, like we said, you look really great. You look glowing.
Yeah,
you
you
look
took a
well
great
rested.
vacation. Yeah.
Not you've had your lips done, your face is frozen, you're overfilled. And so I love that we both agree on that because I think that is way different than a lot of industry trends. I do feel like things are becoming more natural focused and I appreciate that, but there's still a huge market for people that don't look themselves. And I don't want to look back and see my clients or myself not look like a healthy version of ourselves.
Right. We're going to age, right? It's
We
about doing
are.
it
It's
gracefully and naturally.
naturally and gracefully is for sure important.
Could you imagine if you walked home and if you got home and your husband saw you with a big stuffed face and a frozen face and all?
Well, it's so funny. It was the very first time I ever got treated with neurotoxin was in training, and I wasn't planning to do it. And I called Chris to give him a heads up because I hadn't said, I'm going to go get Botox today. He had no idea. And I don't even think he understood exactly what Botox was. He just knew
I've been images in his head, right?
I've been doing all this, training and studying and going and do the live patient training, but he didn't know. But I told him one of the other nurses' clients couldn't show up to practice on, so I'm gonna let her practice on me. And he was like, "What are you doing? You're gonna come home and look like Kim Kardashian?" And I said, "No, you have no idea what I'm doing. I gotta help educate you too because." And I loved it. And that was my very first time I'd ever had Botox done. And I just felt like it just made me feel my face look healthier, younger, glowing, and not the deep set lines that I was trying to start making on my face from frowning at my kids and furrowing my brow and squinting, And so, but it's just so funny what people's idea of this industry looks like. And I love that we're able to hopefully change that and pave a new path forward and what aesthetics could really be.
I love that. I'm so excited for our journey together on this. This is going to be so fun.
We're together. I'm so thankful for you.
Now let's actually look at some videos of what is trending in the industry.
Oh my goodness.
Well, let's get some of your reactions here.
I'm sorry if I laugh. I do snort when I laugh. I can't help it. You've heard me. I'll try not to.
That is somebody that did not go to Lindsay.
No, what is kind of scary about the aesthetic industry is there is not like a universal standard for training and certification for being an injector. I think in Texas, you don't even have to I don't think you have to be a nurse. I don't think you have to I think almost everybody could actually legally inject. I could be wrong about that, and that can happen when we have an injector that's not skilled or well-trained or familiar with facial anatomy. Unfortunately, we have some problem with that toxin drifting into a muscle it should not have drifted into or being injected into an incorrect muscle.
Yeah, and
That's the worst nightmare.
You and all of the medical professionals at Hideaway have been through training at the American Academy of Facial Aesthetics. So we went through hours and hours and hours of anatomy, retraining on those facial muscles, nerves, skin, all of it to relearn those layers before we even tried it on a eye patient.
Hands on a syringe.
Yeah.
I love that about the AAFE because I do feel like they're very strong on the anatomy and precision, and they're very conservative. And I like that when we're going into an industry where we have to be very precise in order not to have those type of results.
Yeah, exactly. We don't want that. No ptosis.
There are always risks involved with any medical procedure, but that is hopefully one we will never cause.
Hi guys,
Oh boy.
I just want to share a Botox procedure that I did a week ago. Was injecting the wrong spot, so I ended up with a droopy eye and also a bigger eye. I called my primary doctor.
Whoa.
because I was very
Yeah, that was also probably similar incorrect injection spots.
Yep. Maybe they were going for a brow lift on that one side, but they ended up making her eye super open.
Who
So
knows?
yeah, and that circular muscle of orbicularis oculi, if you inject too deep and get that one, it's gonna pop your eyelid
You're
open.
gonna have some real wide
It
open
looks
eyes.
surprising. Too bad they didn't etch it.
It's a fine line of what, and very precise. Again, thankfully, there are some things you can do to help mitigate those type of incorrect things happening, but sometimes you just have to wait 3 to 4 months, and nobody wants to look like that for 3 months.
Could you imagine? Yeah, but depth of your needle matters. The layer that you're injecting into matters, and your type of Botox actually matters. And when I say Botox, it means your neuromodulator. That brand matters because each one has a separate science, right?
Which again, we've spent time studying that, and I'm studying that for sure.
Botox gone wrong. I look like, what's that cartoon with the little cigar?
She snorted too.
So this is covered in the advanced Botox training course that I just completed. Someone injected her DLI instead of her DAO. And so that can happen for sure with an unskilled injector and not precise placement, because those muscles in the lower face are so close together and overlap. And again, the depth of the needle matters. The dose of the toxin matters.
Right. Yeah. And we always do a 2-week follow-up whenever we do Botox, especially your first time around with us with Botox. We want to be conservative. We want to use the smallest dose possible to get you the result that you want. And for us, sometimes that means we didn't give you enough. So we include that 2-week follow-up to make sure that we've gotten you completely to the level that you want to be. Yeah, as we're learning your anatomy. And we take photos and we document it so we know exactly how much is going where, so that we learn your face and we know for the next time.
We're definitely on top of being very precise. I love, not everyone marks up their patients. I do. I like to mark exactly where I'm going and take pictures and remember exactly where it was, because another complications can arise too from patients not following post-op instructions. So not necessarily a bad injector, but rubbing their face and moving the neuromodulator around where it doesn't need to be in other muscles. So that's why we take, strong care in making sure our patients know exactly what they're doing when they go home, to let that muscle relax the way it needs to and that medicine set in, and not heat up their body, not rub their face. No, don't go get a facial or massage those areas. So important.
Even something simple as don't put a ball cap on if you've had head and frown lines, Botox done. Yeah.
So it's going to compress that area. And so.
Yeah, love it. Lindsay, I'm so happy you joined me today. I'm so excited to do this with you.
Me too. I'm so thankful to be here. Thanks for having me. Thank you.
If you haven't liked and followed our podcast yet, please do that. It really helps us get the word out about us. And I'm excited to jump right in.